I'm not sure I can put my camera on anymore for some bizarre reason.
I'm sorry, let me just make you the host. That should allow you. Sorry about that, Evelyn.
Sorry, just trying to call me on Teams here, so sorry. I just turn that off.
Okay.
Is that me? I can be seen now.
No, not yet.
No, it's bizarre. Not that it really matters.
Yeah, we can maybe just get started.
Yeah, that's fine. Okay, folks, I'm sure. Oh, actually, I found another button. That might be what it is.
There you are. Yeah.
There I am. There I'm not. Take 2 seconds. Hi, everybody, and welcome to the Health Literacy UK events for Health Literacy Month in October. And we are absolutely delighted that you can join us today because we know there is a lot of competing events going on just now, and it's a bit of a great thing that we actually need to make some choices or run from one event to the next. So that's great. It just tells us how much critical mass is out there on health literacy. That's fantastic. So I'll let you get on, and I hope we enjoy the rest of this event, and I'll pass over to Anne to introduce Catherine.
Thank you, Evelyn. So this morning is the first of our webinars celebrating Health Literacy Month, and we're delighted to have Catherine Jenkins with us. The theme of this year's webinars for us for the UK Health Literacy Month is celebrating research and interventions which promote health literacy through community empowerment and co-production. So a focus on engaging people in communities and different cohorts within the population to look at different aspects of health literacy and its importance and how it can be applied to different aspects of people's life. The webinar will be recorded and made available on the UK Health Literacy website at the end of the month. And as I say, this is the first in the series, and there will be 2 more throughout October, and I'll give you details on those at the end. So Catherine, you're very welcome. Thank you very much for starting our webinar series. And your research and your presentation this morning is involving children in health literacy research. So Catherine Jenkins is a PhD candidate in children's health literacy at London South Bank University. She is researching the potential of public libraries as settings for promoting critical health literacy in children. She works in North East London Foundation Trust, Knowledge and Library Services as Health Literacy Programme Manager. So we're delighted that you're here, and we're very excited to hear more about your research. You were the poster winner at our conference this year, so it's fantastic to have an opportunity to hear more about that award-winning work. And we'll have an opportunity for questions and comments at the end of your presentation. So I'll hand it over to you now, Catherine. Thank you.
Thank you so much. I am now going to seamlessly share my screen, hopefully. See whether... Just taking this time.
Yeah, it's coming, we can see. Yeah, great.
Okay, thank you so much for coming along today, and to HLUK for inviting me to speak today. As was just mentioned, it's a very busy month, it being Health Literacy Month, so I feel very privileged to be able to speak to you all. I will be speaking today about my PhD research. I'm just entering the final year of it. And I am focusing on involving children in health literacy research. I just wanted to say a little piece about the drawing that I've got in the center of this slide. This drawing is from one of the child advisors who helped to design the research. and I just think it's fab, and I really wanted to feature it. I involved 2 different sets of children in my research. So one set of children were involved as child advisors as part of a children's advisory group who were consulted on the way that the research would be conducted. And then the second set of children were involved as research participants. So a brief overview of the research. I'm looking at the potential of public libraries as settings for promoting critical health literacy skills in 7 to 11-year-olds. Why is this important? Why do I care about it? Well, critical health literacy enables children to do very important things, even more important, I think, during this pandemic period, and those are to reflect on and relate to health information in critical ways, and also to take action on the determinants of health relevant to them and their communities. And embedding this right to develop critical health literacy earlier in the life course not only benefits children now, but it'll also benefit them as future citizens as well. And I was particularly interested in critical health literacy in children because when I did my literature search, it demonstrated that not a lot is known about in this area, but also my work in the NHS involves going into schools. And while we had not much trouble designing curricula for secondary schools, we did struggle a little bit with designing a critical health literacy curriculum for upper primary school age children, so key stage 2. So with both of my hats on, I really wanted to look at these. It's not easily measured. As you all know, there's a whole host of tools in the health literacy tool shed, but there aren't many which look at critical health literacy in children. And what we found when we went into the schools as well is that critical health literacy is not easily, not easy to make it happen within formal health education contexts like schools. And what I really, really like about critical health literacy is that it doesn't rely on generic basic literacy skills. And this means that children, even very young children, are completely capable of mobilizing their embodied experiences to reflect on and make meaning from health information from their perspective. So I think it's quite exciting in that regard. And I really like this tweet that I've got on this slide here. This is a tweet from a public library setting using Lego to do data visualization around COVID to make that data accessible to children. And I think that's really great because, again, as we all know, critical health literacy is not just a single thing. It's very much based on context, and there's digital literacies, there's environmental literacies, and there's data literacies. So I just really, really liked that tweet. Okay, so I had great plans for involving children in my research pre-pandemic, and then the pandemic happened, and those plans just went whoosh out the window. So I had to transition my plans over to Zoom. And actually now looking back, I'm really, I'm very humbled, and I'm very grateful to have had the opportunity to work with children on Zoom. It has taught me so much. And I was quite lucky because when I began researching with children, both the child advisors and the children that I was interviewing, at that point in time, they'd already been homeschooling in the UK for a while. So they were already very familiar with Zoom. And in fact, they were way better on Zoom than I was. So I've just got a little screenshot here of I'd produced the kind of, how to use Zoom basic guide, and they just knew it all already. They were like, okay, yeah, we know this. I had children telling me that they had already learned to program and code using Scratch. which is one of the coding languages, and Python. And I was like, you are already way ahead of me. So, you know, we had really great engagements on Zoom. We talked about masks. We did a critical health literacy activity based on a draw and write activity. So using a storyboard. There is a drawing here from one of the child advisors. The prompt for this drawing was draw a child wearing a mask. So I kept it quite open. This child drew a child wearing a mask, dreaming of freedom. And that's in the dream bubble there. And with messy hair, and the messy hair indicates frustration due to the lockdown restrictions and not being able to go out. So the draw and label worked really well over Zoom. And on the other side of the slide here, I've got another little storyboard. I took this from another piece of research. So my background is in information science, and there's a really interesting overlap between information science research and health literacy research. And this was taken from a paper which also interviewed children over Zoom about their information needs. And I really liked how they did this. So they took screenshots of the video, ran it through a magic Photoshop, and then overlaid speech bubbles on top. And I just thought it was a really nice way to visualize the data in a way that would also be appealing to children, because so many of the children I spoke to were really keen on the draw and write activity, and were really keen when I compared it to a comic. One of the children I interviewed said that the mention of draw and write in the advert was what made them want to take part. So that was really nice as well. Another interesting thing about using Zoom was how embodied it was, even though we were all online. It was also a very physical process. So in some cases, I was plugged into a TV in the living room, the other side. So my face was like massive and probably dominating the living room. I had parents attending for part or all of the session, or dropping in and out, and they were contributing as well. We had an ice lolly incident. We had pets. We had Jiggly Leg making the recording very distorted. So we had, we had lots of experiences and lots of learnings. And I guess one of the other things that I picked up on was how critical children can be about the research process. So for example, when I talked about how I would store their data, children are very interested in, how many years it would be kept for, where I would store it and things like that. The technology I would use to store their data as well. So lots of learnings to be had there. So researching with and for children. When I went into this project, I was so keen to involve children as much as possible without also burdening them. So as I mentioned, I set up a children's advisory group, and I did that on the consultation model of participation. So I was consulting the members of that group on the ethics of the research. So the test I used for this was, in principle, would you be happy if your brother or sister wanted to take part in this research? Like, would you feel that it was safe for them to do that? The relevance and interest of the research for children of their age, and the research design, including piloting the recruitment process, so looking at the posters, looking at the consent documentation. I had really valuable feedback from children on both of those. They really helped to make the poster and the consent documentation so much better. And also data collection tools, which included the critical health literacy activity and a modified interview technique. And I mentioned that the job title that I kind of agreed upon with the children in the advisory group was child advisor, but I also received this suggestion, which remains my personal favourite, helping Catherine from a child's perspective, or HCF ACP for short. I just love it. I was also informed by Laura Lundy's model of participation for the research, and I was drawn towards that model in particular because I read a lot in the literature about, the necessity not just to focus on children's voice, but other aspects as well. And I agreed with that. And what I like about the Laura Lundy model, as well as referring to the United Nations children's rights, it also refers to the importance of giving children space, audience, and actual influence when expressing their views. And I to kind of track how I was doing this, like whether I was doing a good job or not, I used the feedback form on this slide, which is available open access and is in accordance with the Laura Lundy model, to gauge from children what I was doing okay at and what I needed to improve on. And then in the middle then, I've just got a photograph of postcards and stickers, because a lot of my engagement with children was online. So I really wanted to give us the opportunity to also engage with the research offline. So we decided that I would update the children via postcards and letters. And I've had really lovely feedback from children, some of the nicest emails I've ever had, really, sort of saying, how much they welcomed having mail addressed to them. Or in this case, addressed to their research nicknames or the pseudonyms they'd chosen, which ranged from everything to Ginny Weasley, Star Wars characters, YouTube influencers I've never heard of, and somebody chose ice cream as well, which I think is just an amazing nickname. So learnings, I really wanted to reflect on how much I learned doing this, because I've literally learned so much. So one of the first things I learned was to pack with care. So when I started to be able to do face-to-face research with the children, when COVID restrictions had eased a little bit and I was traveling to do interviews with children in person, I packed a little research toolkit. And this became really important for children being able to kind of position me as a researcher, but also for them to position themselves. So they really enjoyed having the clipboard. This is a picture of my bum bag that I had with my phone, which acted as the recording device when we were doing walk along interviews, and pens. So I cannot emphasize enough how many pens are needed. This is a big thing I've learned, is that children love pens. Pens are really, really good for getting people to come up to you when you have a stall and you're recruiting participants. And just pens are a key part of this research and should probably be included in my acknowledgements. The center picture, I took this from YouTube Kids guidelines for how to make interesting, engaging video content for children, because I just thought this gave me some really important questions to think through when I was explaining the research to children. And it's the relevance of the research to children's lives, and the fact that they are giving up their time to contribute to it. So I just found that a really handy sort of little guide to help me think through things. And then also the help out there that was already available. I was very inspired by existing young persons advisory groups, or YPAGs, including Generation R, and the one run out of Great Ormond Street Hospital, and also the Open University Children's Research Centre. And I learned a lot from tweets from researchers in this field as well, which were, again, invaluable. And I've got a picture here in the corner of the thank you packs that I worked with my research partner to put together for the children. And my main tip here was identifying, in the words of one of my research participants, the team with the best budget and the best incentive packs. And they were really, really good at producing goodie bags. So that definitely helped as well. And then finally, some further learnings. So I mentioned that I also piloted an interview technique with my child advisors that I then went on to use with the child research participants. And this interview technique, it's called Interview to the Double, or ITTD for short. And it was originally developed with factory workers, whereby the factory worker would be encouraged to provide as much detail as possible into the nitty-gritty of their everyday work, to the extent that the interviewer would be able to effectively be their body double or their doppelganger in work the next day, because they would know exactly, step by step how the other person did the work. And I came across this technique and I thought this would be a really good way to put children in the driving seat for them talking me through how they engage with the setting, especially in relation to health information. But I thought that the body double idea wouldn't really work because I would never get away with being a body double of a child. So instead, I modified it and I called it Interview to the Alien, whereby I encouraged the child to describe how they interacted with the setting as if they were describing it to an alien. So the alien, would know nothing about public libraries as a setting, would know nothing about earthling health information at all. And I think this worked really well. But again, I completely have to credit my children's advisory group because they also came up with the idea of me asking my research participants to do like a YouTube live stream while they were doing the draw and write activity and while we were doing the interview, because so many of the children are on YouTube and some are also on Instagram, even though they're a little bit young. But this kind of worked really well because they knew the concept of, live streaming a YouTube video, and that really engaged them as well. Another learning was that I had to build in loads of time for ethics amendments. I made a lot, and I had basically two separate plans, plan A and plan B. So plan A was going to be, the best case scenario of doing lots and lots of face-to-face research. And then plan B was Zoom-based research if the pandemic worsens. And I had to kind of keep those going side by side. And it was exactly like stepping on Lego with bare feet, just again and again. But again, I think it has, I learned so much from it. So it was all worth it in the end. I made multiple revisions to the program of work. So I extended the recruitment window because it did prove quite difficult to recruit children. And I made, live revisions as well in terms of adapting the data collection methods. So one big learning was that it always helps to have backup data collection methods, because maybe the child doesn't want to do a drawing. The drawing did attract a lot of children, but some of them just didn't want to, and that's fine. So I had the backup method of just wandering around the setting for them. And it did really help to have extra things up my sleeve for when those types of things happened. And then finally, between sort of approaching ready-made groups versus forming my own group. So I think if I'd had a ready-made group, it would have definitely helped with recruitment, because recruitment was really slow. But I've now identified a group that, had I come across them earlier, would have been really great. And this is a Brownies group, local to the public library setting that I'm looking at. And the way into the Brownies was that they were working on developing a health literacy challenge badge for Brownies to complete as part of the badge work that they do. And so it just turned out to be really relevant. So there was pros and cons. If I discovered that group sooner, that would have been really great. But then I might have had a less diverse sample, and I wouldn't have met all the great children that I met. So it's all swings and roundabouts. So that's me done. I just wanted to end on this meme. I've seen it a lot online recently, and I keep returning to it myself, because what I really like about it is I feel it's a very accurate representation of doing research alongside children, because you can plan things really like minutely, and then the best laid plans just go to pieces. But what I really like about it is that at the end of the day, even though the front of the horse is a bit sketchy, the horse is smiling, and that's kind of what I wanted to end on, really. The participation of children in my research has made it so much more better than it would have otherwise have been. So yeah, wanted to end on a smile.
That was absolutely excellent, Catherine. A really, really good example actually of qualitative research as well, in a very iterative way that you involved your children in creating and changing your data collection, etc. So that'll be lots of good write-up for your thesis there, right? Definitely. The other thing that I found really interesting as well was, again, which I've found in kind of research before, but and is also found in all of the kind of media literacy, new media literacy with children, is that children are often very much prosumers of information and not consumers, you know, and they have a huge amount of skill in creating multiple modalities often that they share, certainly in a digital kind of way. So that was really interesting. And when they share that, that obviously fits a very distributed health literacy model as well, a very social model. So that's a really exciting, I think, thing that's coming out of your research also. Anne, are you sorting out the questions?
Problems starting my video, so that's the only reason that I haven't appeared back, but I am here. So thank you, Catherine. That was really interesting. If anyone has any questions, just put them in the chat, and we can ask Catherine the chat or the Q&A box, and we can ask Catherine the questions. I suppose for me, I thought it was fantastic the way, Catherine, you had adapted your research during COVID and to consider that. And I thought that was a real challenge that you had addressed. And I suppose there was a lot of learning that came out of that in terms of using Zoom and other ways that we've all been interacting with each other. In your opinion, what would be the critical success factors so far? So what were some of the things that either surprised you or you expected in terms of how your research has developed and what has worked well, I suppose, for us, for learning to take away? I know you shared some of your key learnings in terms of pack with care. That was great, to come prepared with lots of pains. And then I really enjoyed the interview technique. Are there any other ones that you would highlight?
I think I would say never underestimate how much children are engaged and know about what they feel passionate about, because you know, it's like when I did the Zoom basic guide, I was preaching to the converted with that, because they were already way ahead of me in terms of, you know, technological use. But also when we were discussing critical health literacy as a concept, they came up with such amazing examples of exactly what critical health literacy meant to them that I would just not have come up with, because I'm, you know, I don't share their experiences, but I was just blown away by it. And I just felt so humbled. I still feel humbled because I'm still, you know, I'm still in the middle of it. And I just continue to feel humbled whenever I interview one of them, because they are just so articulate. Like 7 to 11, I was really worried because it's quite a large age range, and I was thinking, oh, you know, should I actually have, and this was something else that came out of the child advisors group, should I actually have, you know, different posters and different things to like appeal to, like, you know, 7 to 8 year olds, and then a different one for the older children, because it is such a wide range. But even the 7 to 8 year olds take me to task about you know, data protection and information governance, and ethics. So I'm just always surprised. Yeah.
Yeah, I think that was something that I picked up on when you were presenting, that they were so interested in you know, GDPR and data retention, and something that it's great to hear that they're very aware of it, because they're so used to doing things online, YouTube Live or social media. So that's almost something that they are being born with an awareness of or growing with. But I thought your research really highlighted the importance of engaging children. And sometimes we might assume we might know, but actually giving children a voice, and this is a perfect example of how, and considering that they are, you know, such a huge portion of the population here in Northern Ireland. It's about 20%. So certainly their voice should be considered. We have lots of praise and claps, virtual claps and well dones for you, Catherine. A comment from Joanna Dowd. Great insight, Catherine, into your research with children and their health literacy. Many thanks. So Joanna has been working with us here in Belfast to develop a pharmacy skills resource. So it is to be launched in the coming weeks, and it's really to work with children throughout primary school, all ages, to provide lessons and resources to think about the link of self-care and the use of pharmacy services, particularly for minor ailments. So direct people to pharmacy as their first point of call for health information and advice. So we've been delighted to work with Joanna, and it'll be great to share that document when it's ready. But I think there's a lot of learning from what you're saying into how we can use this for future planning. Now, Joe has a question about brownies. Let me just see, Joe, is Health Literacy Challenge Badge a national brownie badge or just a local one? So I think that was referring to the picture that you used in your slides, Catherine.
Yeah, so at the moment, it's just a regional one, but I would love to see it elsewhere because I think it's just such a cool idea. I didn't come up with this idea. This came from the brownies, and I just think it's amazing, you know, that that they're considering embedding that and trialing it at the moment, because I do think it's fab. And yeah, on the note of, you know, involving children at this time, I just wanted to say that I've really stood on the shoulders of giants and been so lucky to be doing this research right at the same time as researchers like Lucy Bray and Rosie Nash are looking at health literacy in children and health literacy in response to the pandemic. So their papers have been like so helpful to me, and, you know, really encouraged me to think about how important it is that children are given a platform to, you know, express their views on what's happening, because so many of my interviews with children, you know, were along the lines of their choices. So whether they chose to wear a mask, you know, in their everyday life, and whether that was, you know, that just them wanting to protect themselves, and then also for them to protect others as well. So it was really eye-opening for me in that regard, that they, you know, they are making decisions, and, you know, really big decisions.
Absolutely. A comment from Susie Sykes, great work and presentation, Catherine, and Evelyn saying excellent work. I'm sure you will have no trouble passing. Lucy Bray, so who you have mentioned, I know Lucy presented at one of the seminars when we were able to be in person in Stoke-on-Trent. Lucy said it's a really great presentation, Catherine, and 100% agree that children's abilities should not be underestimated. We have so much to learn from them. And Joe saying a great idea to be able to recruit groups like brownies with rewards of badges too. Yes, we all have a badge or a sticker. That would be excellent to get. I don't see any other questions, Evelyn, unless you have any other questions for Catherine.
No, I just again wanted to thank you, Catherine, and I think some great points coming through again, as we say, about children's abilities, about us as adults making assumptions about any age group and their abilities. I think it's really important, you know, don't assume that people at the other side have loads of skills because they are in the kind of post internet, but also don't underestimate. The data savvy part for me as well jumped out, because there is an assumption that young people are sharing too much and not thinking about the decisions that they make and about what they share or how their data is managed, and that doesn't quite come across in a lot of, like, Lawrence's research, etc., around, you know, data. So that was really interesting as well. But overall, I think it's great, just as you mentioned, Lucy, you know, Rosie, Orkan, all of these people that are kind of really trying to get this critical mass of children's health literacy. I think this is a really exciting time for you to do your PhD, and very, very timely. So I wish you absolute luck in that. But it sounds like you're doing really well.
Yeah,
well done.
Just one final question or two have come in. One from Samantha Belfridge asking Catherine, she's wondering if there's a plan to include children in the dissemination of your findings.
Thank you. That's such a great question, and it's something that I've been discussing with the child advisors, because I really wanted their views on it, because, you know, I know nobody's going to read the actual thesis, like not even adults are going to read that, but I really wanted a, you know, a way that children could engage with it, and they've been so helpful in coming up with loads of really great ideas. Reproducing the findings in Lego remains a popular one. I continue to think about that one. I don't quite know how I would do it. Making it into a game, like, you know, gamifying it in some way was another suggestion. Lots of children are quite keen on me making a little video or an animation that could be shared on social media, and then parents could share the link with children. One suggested that I get it on BBC Bite Size. I think that's yeah, that's not going to happen, but a really interesting suggestion. So they've been really great in you know, sort of suggesting those ways. The most popular one has been to do a poster, and lots of the children were very familiar with the concept of a research poster because they've had to do one in school, and they were like, you should definitely you know, do posters, and then, you know, share them on social media, and also put them up around town. So yeah, I would love to do a nice little poster with some really nice graphics that would, you know, communicate what I find in a really concise way.
Great. Joe is asking for your contact details, if you're able to share them, Catherine, in case anyone has any questions. If you want to put them in the chat, then
Yep.
can share. I know we tagged you on Twitter, and we are sharing your slides with your permission, and you can add your email address to that. But yes, so they are jenkinsc7@lsbu.ac.uk. Thank you.
I should have added them to the slides.
Perfect. No, thank you. So Alicia is saying fantastic talk, Catherine. I really enjoyed it. Just as a follow-up on the dissemination of results, you may be aware of the journal Frontiers for Young Minds. This may be another avenue for you, and there's a link shared to that.
That would be fab. Yes, so one of the child advisors mentioned this, and that would be really, really good, because then there could even be the potential of including children as co-authors, which I've seen done, where, you know, they get proper credit underneath their pseudonyms as having contributed to a piece of research. Because at the moment, you know, I've said I'll give certificates that they can put in their progress files or records of achievement, but to have an actual publication would be great. So I'll definitely look into that. That would be amazing, because I've read some papers that have been co-written with children, and yeah, just awesome.
And it would be lovely to have a child-friendly version of the paper available as well, wouldn't it? It would be fantastic with some of the illustrations that they've come up with. And so thank you very much, Catherine. It was a delight to have you with us today. A really, really informative and thought-provoking presentation. And we look forward to the final results of your research and continuing to find out more about research being done with children and for children around a very important topic. We have 2 more seminars in the series, and the next one on Tuesday the 19th of October, which is Community Health Champions, and the title is, oh, it's a health literacy project, isn't it? So the presenters will be Z Kamula from the Community Health Champion Coordinator at Voluntary Action Stoke-on-Trent, and Dr. Mike Oliver, who is a member of our Health Literacy Steering Group and also a health psychologist. We look forward to that. And on Tuesday, the 26th of October, the topic is Health Literacy in Action, and it's Claire Ramsey, the Health and Wellbeing Manager from the Northern Health and Social Care Trust, who will be presenting. So a link to both of these webinars will be sent out to you if you registered for today's seminar, and also distributed through our social media, our Twitter page. So I hope you enjoyed today, and I look forward to joining us in the upcoming webinars throughout October. So enjoy Health Literacy Month, and continue to push forward on the topic. Thank you.